Subscribe to our channel, and hit the bell icon, to never miss a video from us. Hi everyone, welcome to Test Prep Training. In this video you will learn about the top interview questions for Board Certified Behavior Analyst. So let's get started. Question number 1, do your thought process is the essence of an ABA therapist work? Your answer is, an applied conduct examination specialist helps clients in interactive abilities advancement, language procurement, self-improvement methodologies, and advancement of day-to-day living abilities by applying different social restorative mediations. ABA advisors help patients in changing their conduct so as to make them more useful, socially dynamic, and with solid learning. Question number 2, envision that you are working with an autistic child. What measures would you take to assist him or her to indulge in extrovert activities? Your answer is, it is hard to give a standard response here as every kid, with chemical imbalance has different learning capacities, and restrictions, so every youngster must be treated by these. The principal thing I do in a circumstance, for example, is to tempt the kid's creative mind so the person can decide the tomfoolery, related to an outgoing individual movement. The labor lies upon how they respond, I simply take their sign. Question number 3, what kind of patient-specialist relationship do you avoid when treating patients? Your answer is, it is undeniably challenging not to get genuinely engaged with a patient. Generally of the day, a patient is in my consideration, and it ultimately depends on me to furnish the person in question with all that the individual necessities both genuinely and inwardly. While it is troublesome, I make an effort not to get genuinely involved, nevertheless keep up with sympathy, and seeing so I can treat them really. Question number 4, name some therapeutic techniques that you like to use most. Your answer is, I typically conclude the methods in the wake of assessing the case anyway. The ones I utilize most normally, and have viewed as exceptionally viable include, crucial reaction preparing, encouraging feedback frameworks, and coincidental instructing. Question number 5, what is the basic information you collect while compiling initial case history? Your answer is, the underlying case history information structure incorporates data like the name, age, the orientation of the patient, their clinical history, conjugal and financial status, birth request, perceptible physical and conduct issues, and such. Question number 6, share a time when you had to face an obstacle? How could you handle it? Your answer is, I was treating a medically introverted kid utilizing a blended strategy that used essential reaction and coincidental showing techniques, and the youngster was answering emphatically to the therapy. Out of nowhere, his condition deteriorated and I was disheartened. I changed the system yet couldn't accomplish the ideal outcome. On additional examination, I figured out that the kid was being tormented at the school by another class individual. I facilitated with the instructor and the issue was at last settled. Question number 7, what measures do you take to ensure effective coordination in your team in order to achieve set targets? Your answer is, whenever I have relegated a group task I plan a day-to-day brief whole gathering with all colleagues, and a week-after-week progress advancement investigation meeting. This empowers more than adequate correspondence, and trade of data in regards to the case or cases, and the future treatment plans are additionally chalked out in these meetings cooperatively. Question number 8, what are the roles of behavior analyst? Your answer is, the primary responsibilities of a behavior analyst include helping create individualized interventions for children with autism spectrum disorder by guiding parents based on their child's specific needs. They are also responsible for monitoring progress charts periodically, which will help them identify any adjustments that they may need to make during treatment plans to continue improving the success rates. Question number 9, what is the difference between a certificate program and certification? Your answer is, an endorsed testament program can give the coursework important to be qualified for affirmation as a BCBA, or BCBA. An authentication program can likewise give instruction that might be exceptionally valuable to people not seeking after any sort of certificate, like a few instructors and guardians. A testament program should have the BACB endorsed grouping of coursework to figure in with certificate qualification. Accreditation by the Behavior Analyst Certification Board is just accessible for individuals who as of now have an expert's, or alternately 4-year college education in an applicable field, finish the necessary coursework, and who as of now have, or will actually want to acquire, Managed Insight in Applied Conduct Examination. Question number 10. What is the career outlook for a behavior analyst, or specialist who specializes in autism? Your answer is: the interest for conduct examiners who have practical experience in autism far surpasses the number of people with the mastery expected to give successful ABA programs. The analysis of mental imbalance is expanding quickly. In excess of 500,000 people younger than 21 are at present determined to have a mental imbalance. As per the U.S. Division of Education, chemical imbalance is relied upon to have a proceeding, with the development pace of 10% to 17% yearly. The Centers for Disease Control gauges an increment from 1 of every 150 to 1 out of 110 youngsters has a chemical imbalance range jumble. Such emotional numbers and a deficiency of qualified mental imbalance experts drive a solid interest for prepared experts. Question number 11. Is all therapy done in the home? Your answer is: treatment will probably start in the home. Notwithstanding, learning through speculation might happen in all settings the youngster might be in. Exercises outside the home can be a significant piece of the home treatment program contingent upon the kid's requirements. Interactive ability advancement, for instance, happens best in regular group environments, for example, playdates, local area trips, playgroups, or kid care settings. Question number 12. Who is the employer of the home therapist? Your answer is: the Regional Health Authority gives the financing to the home therapist's compensation. However, guardians are viewed as the business of the home therapist. The Public Authority of Newfoundland Labrador covers the necessary employment insurance, and Canada pension charges yet don't give workers compensation inclusion. Question number 13. What does ABA therapy resemble? Your answer is: ABA treatment is planned to show the middle components of autism spectrum disorder, social, or play capacities, correspondence, and lead. The intensive ABA program uses simply evidence-based treatments and methods with showed suitability. All learning is the development and play setup, and is individualized based on your child's resources and prerequisites. The goal is by and large that your youth will sort out some way to move, summarize, capacities among a grouping of conditions. All of your adolescent ventures should be uncovered to you, to the extent that how these are associated with the goals set by you and by the ISSP bunch. Question number 14. What is a board-certified behavior analyst? Your answer is: the board-certified behavior analyst is an autonomous professional who additionally may function as a worker or self-employed entity for an association. The BCBA conducts elucidating and orderly social evaluations, including useful examinations, and gives conduct insightful understandings of the outcomes. The BCBA plans and directs conduct insightful mediations. The BCBA can actually create and carry out suitable appraisal and intercession strategies for use in new circumstances and for a scope of cases. The BCBA looks for the counsel of more experienced professionals when important. The BCBA helps others to complete moral and powerful conduct insightful intercessions in light of distributed examination, and plans and conveys guidance in conduct investigation. BCBAs regulate crafted by board-certified assistant behavior analysts, and other people who execute conduct insightful mediations. The Behavior Analysis Certification Board grants this qualification to people who have met coursework, degree, hands-on work, and assessment prerequisites. Question number 15. What are the qualities that a behavior analyst need to be successful? Your answer is: a behavior analyst should have strong interpersonal skills that include excellent verbal and written communication skills. That is important since they will be required to communicate often with both children and their parents, which can sometimes be challenging. Working on a team or individually also plays an integral role since we usually have groups working together at any given time, while ensuring that each individual's voice is heard without interrupting others who may not feel comfortable speaking up first. For more such videos, subscribe to our channel.